Hello everyone. Today, we're exploring the medication known as Taltz, with its generic name being ixekizumab. As always, this discussion is for educational purposes. For any health-related concerns or questions, please consult a medical professional. Description: Taltz, or ixekizumab, is an injectable medication primarily used to treat various autoimmune disorders, including plaque psoriasis, psoriatic arthritis, ankylosing spondylitis, and non-radiographic axial spondyloarthritis. Taltz functions by reducing inflammation, thereby improving the symptoms of these conditions. It is a monoclonal antibody that binds and neutralizes a naturally occurring protein called interleukin-17A, IL-17A, which plays a role in inflammation and immune system responses. By binding to this protein, Taltz reduces inflammation and alleviates symptoms associated with the aforementioned conditions. Who can use Taltz? Taltz has received FDA approval for the following treatments: plaque psoriasis in patients aged 6 years and older who have moderate to severe plaque psoriasis and are candidates for systemic therapy or phototherapy. Psoriatic arthritis in adult patients with active psoriatic arthritis. Ankylosing spondylitis in adult patients with active ankylosing spondylitis. Non-radiographic axial spondyloarthritis in adult patients with active non-radiographic axial spondyloarthritis that shows objective signs of inflammation. Warnings: Taltz can affect the immune system, potentially leading to increased susceptibility to infections, some of which can be severe or even fatal. Symptoms like fever, chills, sweating, muscle pain, weight loss, skin sores, shortness of breath, and cough with red or pink mucus should be reported to a doctor immediately. Additionally, there's a risk of tuberculosis, and your doctor might conduct tests to ensure you don't have TB or other infections. Serious hypersensitivity reactions can also occur with Taltz. Live vaccines should be avoided during treatment, and there's a potential risk of inflammatory bowel disease, including Crohn's disease and ulcerative colitis. Before taking this medicine, ensure you're not allergic to ixekizumab or any of the inactive ingredients in Taltz. Inform your doctor if you have an active or recent infection, Crohn's disease, ulcerative colitis, tuberculosis, or if you're scheduled to receive a vaccine. Pregnant individuals or those planning to become pregnant should notify their doctor, as the effects of Taltz on the unborn baby are unknown. Similarly, if you're breastfeeding or planning to, consult with your healthcare provider. Dosage: Taltz is administered as a subcutaneous injection using a pre-filled syringe or autoinjector. The dosing frequency varies depending on the condition being treated, but it's essential to follow your doctor's instructions carefully. For plaque psoriasis in adults, the usual dose starts with 160 mg, 280 mg injections, subcutaneously at week 0, followed by 80 mg every 4 weeks. The dosage differs for pediatric patients and those with other conditions like psoriatic arthritis or ankylosing spondylitis. Side effects: like all medications, Taltz can cause side effects. Some individuals might experience allergic reactions, infections, diarrhea, painful skin sores, cough, shortness of breath, and signs of fungal infections. Common side effects include pain or redness at the injection site, nausea, ear infections, and cold symptoms like stuffy nose, sneezing, and sore throat. Always consult your doctor about any unusual symptoms or side effects. Interactions: Taltz can interact with other medications. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking. Some known interactions include carbamazepine, cyclosporin, quinidine, sirolimus, tacrolimus, and warfarin. Avoid: while on Taltz, avoid receiving live vaccines, as they may not work effectively during treatment. Examples of live vaccines include measles, mumps, rubella, MMR, polio, rotavirus, typhoid, yellow fever, varicella, chickenpox, zoster, shingles, and nasal flu, influenza, vaccine. FAQ: many wonder about the interaction between Taltz and alcohol. While Taltz itself may not interact with alcohol, both the American Academy of Dermatology, AAD, and the National Psoriasis Foundation, NPF, recommend limiting alcohol intake for patients with psoriasis, as it might increase the risk for severe disease. Closing. That concludes our overview of Taltz. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.